Okay, this is Kay Afji, and I'm taping the lecture for Leadership and Management Theory for Learning Plan number 12. Before we get into the actual theories of management and leadership, I wanted to just show you what an organizational chart looks like. They're available whenever you would go to interview for a position or anything. You might want to take a look at the organizational chart to show you how the organization is arranged. The one that you see is a rather small chart, and it just focuses in on a basic nursing department. The top person on the chart is the person who's accountable for everything that goes on below them. So the director of nursing is accountable for the nursing department. The supervisor is an RN who's responsible for maybe a department or a certain unit. And then below the supervisor are the charge LPNs. There's a charge LPN maybe for a particular unit, and like unit A, and a charge LPN for unit B, and then the overseeing supervising RN. So this would be an example of like in a long-term care facility. There's always a RN available to monitor and supervise the actions of the charge LPNs. And then below the charge LPNs, you'll see the nursing assistants or other unlicensed assistive personnel who would be providing the actual care, basic nursing care to the residents, and they would then report to the charge LPNs. Okay, we're going to talk about leadership and management. Leadership and management usually are kind of used interchangeably, but they really are not necessarily the same. When you look at a leader, leadership is more futuristic. It requires inspiring people to follow them. It's a way of behaving. People follow because they want to, not because they have to. Leaders will energize others to follow. They help to create a mission for the group. They inspire people to strive to accomplish particular goals. And leaders are not necessarily hired into a position of leadership. There are the formal leaders that could be the supervisors or the charge nurses or whoever in the facility, and there are the informal leaders who don't have a set position of leadership. They're just people that staff goes to for advice, or they are people that, while they don't have a position that they're hired into, are the people that the staff seems to follow. Okay, management is more task focused, so it's not really futuristic. It doesn't inspire people to follow them. Management is more the day-to-day operations. They say management involves more of the perspiration rather than the inspiration. Ideally, leadership and management should complement and build on each other to be most productive, but that doesn't necessarily mean that always happens. A manager is assigned or hired into a position, and the manager focuses on the organization's day-to-day work. What that involve? The manager is driven by external organizational rewards. So the manager supports the goals, the strategic plan of the organization. It provides means to achieving the organization's goals. So as we talk more about the management theory and the concepts involving what a manager does, we'll get into it a little bit more specifically, but what it does is the manager will monitor to make sure that the resources are available so that the organization can meet their goals. The manager gets things organized so that the leader's vision can be achieved, hopefully. The part of the management function is to organize and get things running and make sure, again, that the resources are available so that the staff and can meet the organizational strategic plan. The management functions are planning. So they determine what needs to be done. In the case of the charge LPN, we're going to look at their management functions. So planning would be, assisting in planning would be part of the function of the charge LPN, helping to determine what needs to be done for each patient, assisting the RN in the development of each patient's goals. Again, that would depend on the patient's status, so the LPN would collect data, bring it to the nurse's attention, and assist with the development of the patient's care plan. Organizing also is a function of management, and that determines how it's to be done. So the charge LPN, after developing the patient's goals, would assign staff to take care of meeting those goals or achieving those goals. So they would have to assess and make the decisions based on the competencies of the staff who's performing the work to decide who would be responsible for doing what part of the patient's plan of care. Work can be delegated to other staff, so unlicensed assistive personnel or to another LPN based on licensing regulations and the facility's policy. Then directing, instructing who is to do what, so providing enough direction and supervision to the staff to make sure that they understand, what's to be done. And then controlling is another management function, and that would be when and how it's to be done. So it's more specific than just directing. They're actually being specific as to what needs to be done. The charge LPN then would communicate the regulations, policies, and procedures to be followed, and then they would evaluate the staff's compliance in following those procedures and policies. There are several different types of management style. We're going to look at them now. Okay, the autocratic manager is authoritarian. That manager is extremely directive, and it's also known as a bureaucratic manager. This type of person believes in achieving goals by setting objectives and having them carried out without any input from others. So they don't ask for advice from staff or any input from staff. They make their decisions on their own. They believe they have complete authority and should not be questioned. They don't encourage individual initiative or cooperation among members of the organization. What they say, pretty much they expect to be carried out. They're very task-oriented, very high task-oriented, very low social orientation. They make decisions independently and issue orders to those that are working with them. Communication goes from the top down and not from, staff to the manager. This style of management does not work well in many situations, but in some situations it's necessary. So an example of when it probably would work well is when you have an emergency and one person has to take charge. So if there's a code that happens, one person steps in and directs everybody else and expects their instructions to be followed. Another example might be if you have a really inexperienced work group and they're not exactly sure what they should be doing. An autocratic manager might be helpful because they would direct the new people into exactly what they expect them to do and then would expect them to carry that out. The next type of manager is a democratic manager. And this person is probably the direct opposite of an autocratic manager in that this manager focuses on the individual abilities of each person in the group. They encourage input from the staff in helping to problem solve. Decisions are often made through group consensus. So what that means is if there's an issue, the democratic manager will call a meeting and they will talk to the entire group. The group then will come up with solutions for that problem, and then the group decides, again, as a group, how to solve the problem that's presented. The democratic manager is then more of a facilitator in getting the group to discuss the problem, work through the solution, and then come up with the solution on their, I guess, as a majority. So the decisions for a democratic manager are made by the group. An example might be self-scheduling. So the democratic manager would go and put the schedule out. The staff would fill in the hours that they would be available to work. And then any open shifts that weren't picked up, the manager would then go to the group and say, okay, these are the shifts that we need covered. And the group then would have to work through how to solve the problem of having those open shifts. Everybody in the group is informed of organization's goals and directions, and they have a direct relationship in attaining those goals. Again, the manager is there to facilitate, but the staff is very involved in helping to reach the organizational goals. There's not necessarily a power struggle going on. The leader turns problems over to the group to manage, and they help to facilitate that. They lead by suggestion rather than by complete rule, like the autocratic people just, lead by telling people what to do. The democratic manager suggests ways to work, but they allow for the staff to have some input. They persuade and teach staff rather than rule. And group members are usually satisfied because they help manage the decision-making process. As you can see, though, with a democratic manager, it's a lot more time-consuming because you have to get to the group together, you need to talk about the problem, and need to facilitate the group into coming up with a decision or a solution to the problem. Another type of manager is the laissez-faire manager, and this is this one probably would be the direct opposite of the autocratic. I guess if you think about it, the democratic manager would probably be in the middle, and the laissez-faire manager would probably be on the opposite end of the spectrum, because laissez-faire managers have no direct leadership abilities. They provide little direction to the staff. Individuals are allowed to do anything they want to with no direction whatsoever. The result is that people don't really care about what they're supposed to do and may lose initiative or desire for achievement. Everybody's kind of doing their own thing. This style of leadership may work well with a highly motivated work group. People that have worked together for a long time have a pretty good idea of what they need to be doing. Often in a case where there's the laissez-faire manager is involved, usually an informal leader will step into the role, and they will have an informal leader that will be helping to manage the situation, because the staff needs some sort of direction and they're not getting it from the manager that's hired into the position. Now let's look at leadership theory. There's several types of leadership. The born leader is the great man theory. That theory pretty much states that leaders are not made, they're actually born with certain types of characteristics that just lend themselves to being a good leader. Contingency and situational leadership we'll talk about in just a little bit. Interactional leaders, the theory is that leaders can be made based on their experiences. Transactional leadership theory is the carrot and the stick type of thing, where if you offer rewards to the staff, they'll do what they need to, but if they do what they're not supposed to do, then there's a punishment that's involved. So it's like a rewards and punishment type of leadership theory. And then we have transformational leadership, and we'll talk about that too in a little bit. The contingency leader is kind of a cross between a complete, let's say, controlling type of leader and a leader that is one that's open to staff input. So it's kind of in between the autocratic and the democratic type of leadership style. Sometimes it's called situational or participative. The leader, who's a contingency leader, presents their own views to a group, and then the group is allowed to provide criticism or suggestions or advice. The leader then takes the group's feedback into consideration, but the leader makes the final decision. So the staff can allow for providing input to the leader, but the leader is responsible for making that final decision. It works well within a group as well as in emergency situations when events need to be handled quickly, because this type of leader does not ask for the whole team to come up with a decision. The leader still comes up with the final decision. The response still is not as quick as if somebody was a complete autocratic leader where they didn't ask for any kind of staff input. But usually if the leader uses this type of philosophy of asking for feedback from the group is much more committed, I would say, to the leader, and will follow through with the plans that are made because they feel like they have some input into the direction of where the staff is needing to go. Transformational leadership is used in a well-functioning group. The group shares a common vision, and leadership flows among the members based on the tasks and problems at hand and the members' individual skills. All group members are leaders and followers at one point. It doesn't replace formal job responsibilities, but it may be very effective in identifying the best option at the moment and energize others to take action because they're involved in the decision-making process. So probably an example of this would be if you had different members of a staff that had talents or interests in certain areas, and so they were assigned to be leaders in a particular section. So if you had somebody who was really tuned in to following policies and procedures and making sure that all of the regulations are being met in the department, you might assign a staff person to be in charge of quality improvement and making sure that policies are being followed and that type of thing. So the staff person is still a staff person, but they're a leader in a particular area such as quality improvement. If you have somebody who's really interested in new products and starting using new types of equipment and things like that, they may be responsible or a member who represents the unit in a let's say new product evaluation committee. So anytime there's a new product coming into the facility, that member would go to the meeting and they would be kind of a leader in that particular area, bring the information back to the staff on that particular department and try and, work with the staff to institute new equipment. So it looks at the staff's talents, individual talents and interests, and puts them in charge of a particular area, and they are a leader in that particular area of interest. Even though they're still staff people, they have other, responsibilities that they take on, and they're a leader in a particular area of interest. And that would be transformational leadership. Okay, now let's look at communication. All of you have had classes in written comp and oral communication, so we're not going to spend a ton of time talking about means of communication. But if you're in charge and you're responsible for managing a group of residents or whatever, you're going to be communicating with others via writing, reading, speaking, and listening. So when you're speaking, assertive communication is important. So if you have a problem or you notice somebody's not doing something correctly, you need to be assertive in bringing it to the person's attention. Now that's as opposed to being aggressive. Aggressive communication is kind of in your face kind of communication, and it puts the other person who's receiving the communication in a defensive position. So they stop listening because they're becoming defensive. So assertive communication is important. It's important to be direct, honest, and appropriate in ways that do not infringe on another person's rights. And it requires verbal and nonverbal communication to be congruent. So you need to be aware of your verbal and your nonverbal messages when you're speaking to someone. Looking at nonverbal communication, that would involve space. So it's important not to invade the person's personal space, because again, that's going to put them on the defensive. We know that the environment is an appropriate environment to be having communication with a person. Or is it in a busy nurse's station, or where others are going to hear? It could cause the person embarrassment if other people are able to hear the discussion that's going on. Appearance is important. Eye contact as well. How the person's posture, also sends a message to the person who's receiving communication. Gestures like finger pointing and that type of thing sometimes, again, will put the person on defensive, so you have to be aware of your gestures. Facial expressions, also important. Timing. So if the person's in the middle of a busy day and you want to talk to them in the middle of a time when they're the busiest, probably isn't really productive, because they're not going to really be listening. They're thinking about all the things that they need to get done. So timing is important as well. And vocal clues such as tone, volume, and inflection also are very important. As far as listening skills go, we need to take a look at the barriers of when people are not able to really listen. People tend to let emotions dictate what they hear or do not hear. So you want to make sure that they're not emotionally stressed or overwhelmed when you want to talk to them. People also pay less attention to what makes them feel uncomfortable. So if you're going to talk to the staff about a particular incident, you may want to tell them what's going on, but you also want them to tell you back what they understand the issue is, so you're sure that they understand what you've told them. Listening also requires concentration. So again, if they're really busy and they're thinking about a lot of other things, they may not necessarily be able to listen. Some people think that listening is a passive behavior, so they want to take control by talking more. So you may have to ask them to just wait until you finish explaining what the situation is before they start talking over you. And again, another barrier to listening is that there's too many distractions. Maybe the area is too busy or there's too much going on at the time. So in developing your own listening skills, make sure you can hear what is being said. Focus your attention on what's being said. Recognize and control your emotional response so you can understand what they're telling you. Make the decision to listen and accept the feelings and needs of the other person, and pay attention to the nonverbal communication that's being expressed by the person who is talking to you. Fight off distractions. Take notes. Let the speaker tell the whole story, and then after that you can ask questions. It's important to react to the message and not to the person, and to respond positively to the message being communicated. So, if somebody's talking to you about an issue, you need not to take it personally, but to respond positively and talk to the person and say you're going to follow up on it. Make sure you understand what the issue is. And then for written communication, know what you want to say before you start writing. Put the people into your writing, so understand who you're writing for. So if you're writing for a unit assistant, a CNA, you might use different terms than if you were writing to your nursing supervisor. Try to use as few words as possible and be simple and direct in your sentences. Include only the essential information. So don't give a lot of background information. People that are reading that are going to get lost in all the words that are being, expressed and all that intricate detail. So you want to make sure that you keep your written communication simple and direct. Okay, so let's go on to the next section, and that is conflict resolution. As you're going to be in charge as an LPN, you'll find that you're going to be involved in, helping to resolve conflicts. So we're going to look at conflict, and then we're going to look at some resolution or modes of resolution. So conflict arises from differences in many factors such as beliefs, knowledge, opinions, values, personalities, and backgrounds. Now we're looking at interpersonal conflict, so conflict between individuals rather than conflict between departments or organizations or conflict within each person themselves. We're looking at conflict between two individuals or interpersonal conflict. Conflict creates stress and negative feelings that can adversely affect the work situation. And again, it may be within the individual, intrapersonal, between two or more people, interpersonal conflict, or between individuals and organizations, which would be organizational conflict. Again, we're looking at just conflict between two or more people. So the modes of conflict resolution are accommodation, collaboration, compromise, avoidance, and competition. So the modes of conflict resolution, first of all, avoidance. Avoidance is the most common technique used when there's a conflict. In avoidance, conflict is completely ignored, and it's either done consciously because the person refuses to engage in trying to resolve the conflict, or it's unconsciously used by denying that the conflict even exists. The advantages of using avoidance is it enables the people involved to avoid turning a minor disagreement into a larger conflict. It does not overreact to a situation. Not every bit of conflict needs to be intervened upon. Sometimes if you just allow the parties to cool off for a little while, they can resolve their conflict on their own. The disadvantages of using avoidance is that the person could be ignoring a situation that needs to be dealt with. So if conflict is occurring between two staff people and it's affecting the morale of the department or the quality of work that's being provided, then avoidance would not be the way to, the mode to use to resolve conflict. Conflict can sometimes escalate because it's not being dealt with. So it may spread, throughout the department. So then at that point, avoidance would not be the way to go in resolving conflict. So when do we want to use avoidance? We want to use it when we're dealing with trivial issues and there's more important issues that need to be dealt with. It can be used to delay a decision until both parties are calmer or until more information about the problem is obtained. It can be used when the parties' demands cannot possibly be met. So that we can't resolve conflict if their demands are too high. Or when others can resolve the conflict more readily and more easily. So there may be other people that can take care of the conflict that are better equipped than yourself to deal with that. The next mode of conflict resolution is accommodation. It's also called smoothing or cooperating. And at this point, that's when the person ignores his own feelings about an issue in order to agree with the other side. So if it's not really that important to you, you might say if there's a conflict or disagreement, okay, fine, we will do it your way. We will accommodate you. And the advantage of using accommodation is if the issue is minor, it just allows the parties to move on to issues that are more important. It's not that big of a deal. Okay, we'll just do it your way. One side accommodating on one issue sometimes can make the other side more willing to accommodate when another issue occurs. So it's kind of like, oh, well, I gave you in for this problem. Now next time maybe they'll do it my way if another problem arises. The disadvantage of using accommodation is there may be some resentment on the part of the person who says, okay, fine, we'll do it your way. So there may be some lingering anger or resentment. When do you want to use accommodation? Of course, you're going to do it if you're wrong. So you say, okay, fine, I was, wrong. Let's just do it your way. You also use it when the other person really does have a better idea, or the issue is more important to the other party than it is to you. Then, going ahead and accommodating is fine. And then if you're outnumbered or outranked, so if your supervisor has an idea of way to do it and you disagree with it, probably they're not going to change their idea because they have more of a controlling status or position in the facility. So you may have to just go ahead and just comply and say, okay, fine, we will do it that way. The next mode of conflict resolution is competition, and this is sometimes called forcing, where one side wins the conflict and the other side loses. So the winner forces the loser to accept his or her perspective. The advantage of competition is it's useful when an issue is critical or time to resolve an issue is limited. So it's really quick. It's like I win, you lose type of situation. It can help move a critical but unpopular decision quickly through an organization. So it's more of a just do what I say kind of resolution. The disadvantage is that losers tend to resent losing, and that anger and resentment will increase. Those on the losing side of the disagreement may be less willing to engage in future conflicts and may adopt a withdrawing or avoiding style. So it's kind of like they just kind of give up trying to be involved. They have a tendency just to withdraw or avoid dealing with the issues entirely. When do you want to use this? When a quick decision is essential, to implement an unpopular or unnegotiable action, or to defend important principles, individual rights, and group welfare. So it's a real quick way of resolving conflict. Compromise is another conflict resolution mode where each side gives up something as well as gets something. So both sides have a reasonable, important goal, and losing is not required. Just kind of through negotiation, they decide that they're going to compromise something. The advantages are it's effective for interpersonal conflicts. It produces an everybody wins something kind of scenario. It can be an efficient method for resolving conflict when the issues have higher importance and there is limited time for resolution. So we look at the problem, look at the conflict, each person gives in somewhat, and then they come to a conflict resolution. The disadvantages are sometimes winning and losing exchanges might seem unfair, so people may feel like they gave up more from their end than the other person gave up. So one side may perceive that what it gave up was more important than the benefit it received, and it's not as effective if one party is less powerful than the other. So if there's a higher ranking, the person who wins is maybe of a higher position or ranking in the organization. The person who loses that's at a lower level may find that it's not been really fair. When do you want to use it? When each person is firmly committed to different views. A compromise can produce acceptable outcomes. Collaboration is also a win-win type of mode of conflict resolution. Both sides work to develop an outcome that is best for both sides of a conflict. Emphasis is on creative problem solving so that each side meets its key goals. So the advantages of collaboration is it seeks a permanent solution that achieves goals and objectives of both parties. And what it does is it's creative and allows parties to develop new solutions rather than trading win-loss options. So in this case, both parties of the conflict come together, they talk about the conflict, and they develop a plan together to resolve the conflict. So it's not like one person's views win over another person's views. They actually come together and develop a new solution. The disadvantages of collaboration is it can require significant resources such as time, because both parties have to work together to develop a new answer to an issue. It requires that all parties are committed to success, possibly leaving the process open to interference by other parties who don't want the conflict to have resolution. So there are some people that don't want the conflict to be resolved. For some reason, they may be getting some sort of benefit from that. So both parties have to be committed to resolving the issue. And it requires that parties have creative problem-solving skills so that they're able to view the problem and develop to formalize or formulate, I should say, a new solution to the issue. So now let's take a look at this video that helps to demonstrate the different types of conflict resolution examples.